Hello, dear aquarist. Welcome again to my next case of fish diseases. And this time, it might interest some of you who keep cichlids because cichlids are very popular and it's a hobby that many people enjoy because it's a special fish. These cichlids have a special behavior, special colors, special breeding patterns. And this time we're going to talk about a unique species which has been cultivated or bred in Asia as a hybrid. Yeah, I'm gonna talk about the blood parrot cichlid. Some people don't like it, but I tell you, it's a lovely fish and it's a very popular fish in certain parts of the world. So that's why the hobbyists enjoy it. And that's why sometimes we also find some diseases in this kind of fish. And this case I will present you was a complex case, but still I share you my findings that I collected in a PowerPoint for you. It's my case 149 already, a blood parrot cichlid with bad organs, internal organs due to an infection, bacterial or viral. Well, we will discuss it. First of all, I want to show you I have books on fish diseases available for you, also about cichlids. Particularly the New Illustrated has a lot of chapters on diseases of Malawi and African cichlids, Tanganyika cichlids, and South American cichlids, dwarf cichlids, and discus you call it. Here I show you the blood parrots which were showing the problem. Some were getting pale, they're getting a strange behavior, they were getting weaker, and some were dying. But still, many looked okay and did not show any particular sign, and they were eating well. But we examined the ones which were dying and getting weak, and we found, for example, that the liver was in very bad shape. See the black parts are here, the blood veins with collected blood, which is in very unhealthy condition of the liver. And the same is for the spleen. You see the big red bloody markings, like it's not typical a melanoma macrophage center, but it's an unhealthy looking spleen. And the same for the kidney. You see all the blood collected spots in here, which is obstructing and making the kidney working in a poor condition. So all these organs were having a very strange pattern, a pathological pattern. So we could not decide exactly and determine if it was a viral or a bacterial infection. And that's the kind of fish, if you're a breeder or if you're a farmer, and it's a very important collection of fish you have available, you should send it to the laboratory. This sometimes I bring you these cases because it's sometimes important you bring this fish to the laboratory. We didn't do it because the people I worked for didn't want us to invest time or money to send this to the laboratory because many of the cichlids were doing fine. There was only very few losses. So it was not a very bad, serious case, except for a few. And maybe this could have been a viral infection and some fish can develop immunity. And sometimes you can help by applying an antibacterial treatment, like with an antibiotic, but that you should ask your fish doctor or your fish health manager for advice what you can use in this case. I could not tell exactly what we could use, but what we applied in this case is in giving a good fish food that helps the fish to build up a good immune system and helping to repair in conditions when they are sick, like in this case. And we would recommend in such a case our Dr. Baslier Biofish Food Professional Treat, which is a mix of herbs and a good vitamin mix that helps the fish to repair. So try to get my books to get yourself acquainted with the most important fish diseases, or try to become a Patreon member and learn a training program on fish diseases. So I hope this info helps you to be, how can I say, to be a better aquarist and that you can handle your problems. Although this problem was a very special one, maybe viral, maybe bacterial, who knows? Laboratories can help. Yes. Thank you for watching.